precious time, so we'll go with that.
Right. Yes. A very warm welcome. Good evening, good afternoon, good morning from whichever part of the world you're joining from. Shravani, on behalf of the Foundation of Healthcare Technology Society, I'm pleased to welcome you all. This marks the third session of our career and mentorship series, uh, where we come together to explore and reflect on the changing landscape of diplomacy. Before moving forward, I would like to welcome today's speaker, Dr. Ashish Joshi. Dr. Joshi is Dean and Distinguished University Professor of the School of Public Health, University of Memphis, Tennessee, USA. He's a visionary leader, researcher, innovator, entrepreneur, educator, administrator, and a mentor. Before the session begins, we'd appreciate the participants if you could please switch on your cameras throughout the session so that we can have a more interactive experience. And if you have any questions, you can wait till the session ends so that it becomes more interactive and it goes in a very normal way. Sir, you can now share your screen and we can begin this.
Thank you, Shavni. Can you see my screen?
Yes.
Okay. So thank you all. I think this is our third topic for the career mentorship program. And the purpose of this series is to introduce to you the new topics in the field of public health. And as we move along, what are the new areas of skills, competencies, and the knowledge that we must explore as public health practitioners and professionals? And these do get recorded, and my hope is that these provide you some useful insight into the areas of further exploration in the field of public health. So the today's topic is uh, public health diplomacy in an era of complexity, uncertainty, and predictability. And briefly about myself, I'm a Dean and Distinguished University Professor for the University of Memphis School of Public Health and founder of the Foundation of Healthcare Technologies as well as for SMAART Labs. Uh, you know, uh, Obviously, this is a continuation of our previous series, but sometimes new people attend. I just want to mention that a little bit about myself. I'm a physician by practice and public health professional, and a PhD in population health informatics. My area of focus has been on how we can use digital technologies and digital interventions, digital innovations to translate evidence into practice, both at the intersection of clinical care and public health. The topic of public health diplomacy was chosen specifically because of the rapid change in the social, economic, geographic, cultural, and economic variations that are happening in the current world. So before we go into this, I wanted to mention that health, as we all know, is recognized as a leading contributor to development, peace, poverty reduction, social justice, and human rights. So we must recognize that health is a much broader dimension than just manifestation of a disease, and we must look at this of how the health of a particular individual or a particular community or a society or a nation at large contributes to the overall development and also the social justice and the peace in a country and around the world. So understanding of the intersection of health, domestic and foreign policy, and international relations is becoming increasingly critical to resolving local and global challenges, especially during COVID-19. That what we saw that there is a significant intersectionality between the way government and nations respond to the different levels of crisis around the world. And these reflect on the importance of the intersectionality between health and policy as well as international relations, whether it was in relation to the global challenges such as pandemics, climate change, or migration. Now, each of these creates a very complex web of health, social, economic, and geopolitical challenges. And this means that as professionals and as individuals who are specifically focusing in the public health space, it demands a coordinated response and involves nation states, international institutions, and the public to resolve to these kind of crises. So I think the reimagination of public health in the 21st century is happening, and we must start looking from the different lens of how public health plays such an important role, not just locally, regionally, or nationally, but also internationally. So before I talk about like why public health diplomacy, we must a little bit talk about what is diplomacy. And the diplomacy, in a day-to-day thing, whether we are in our work environments, whether we are engaging across different partnerships, collaborations, it's an art and practice of conducting negotiations. So we may not call it diplomacy, but on an every day-to-day basis, we somehow practice that how we need to negotiate, how we need to build consensus, how we need to do conflict resolution. So diplomacy is also defined as a tool or instrument by which states implement their foreign policy and articulate and defend their national interests. So diplomacy is very much focusing on something which helps across the different nations to really prioritize their own national interests when institutionalizing negotiations and consensus building. However, this does not capture the role played by non-governmental organizations and other non-state actors. So even though diplomacy is a very credentialed term that requires engagement between the nations at different levels, there's a role that is also played by the non-governmental organizations and other non-state actors when we are talking about diplomacy. So how does intersection between health and foreign policy actually happens? These are conditions that are regular and integral security concern over foreign policy, especially in the area of emerging infectious diseases, whether it was COVID-19, we did saw distribution of COVID-19 vaccine as one of the things where diplomacy did play a role. Supply chain logistics are others. Health during conflicts and post-conflict reconstruction, and health responses to natural disasters. So these are some of the examples where intersectionality between health and foreign policy is happening. Foreign policy goals that can either hinder or support health. So what is really needed is that we need to strengthen partnerships between the capacities of various ministries, include those of foreign affairs and health. So if I really ask you, think of an example of COVID-19, just as an example of that. So even though that this was a health issue, there was a huge discussion about how the distribution of vaccines will happen around the nations. So it does involve engagement of governments and sectors that were beyond health. So it involved foreign affairs, it involved even the Ministry of Economic Affairs. So there were several ministries beyond health that actually played a very important role, especially at the intersectionality between health and foreign policy. Just to give you backdrop, that there are five tracks of foreign services that are being listed. One of them is called consular services, economic affairs, management, political affairs, and public diplomacy. Interestingly, if you look at consular affairs, they facilitate adoptions, help evacuate, especially in case of Americans, combat fraud to protect the borders, and fight human trafficking. These are the five tracks of foreign services within the US. The second is the economic officers. They work with the foreign government and other US agencies on technology, science, economic, trade, and energy. Then we have management officers that are dealing to be more resourceful, creative, action oriented, responsible for all embassy operations from real estate to people to budget. Then you have political officers that analyze host country political events and must be able to negotiate and communicate effectively from all levels of foreign government officials. And then the last but not the least is the public diplomacy officers that influence opinion leaders, non-governmental groups, or next generation of leaders. But interestingly, if you really find, health never came into a part of this. So health track did not exist as a track of foreign services, which means that those decisions that were made for health were not necessarily made by individuals who came from health background. So I think that's where the challenge as well as the opportunity lied about how and what the role health diplomacy or public health diplomacy can play in the 21st century. So there were formal negotiations between and among nations, and that's the principles of core global health diplomacy. Then there's the multi-stakeholder diplomacy that talks about how the negotiations between or among nations and other actors not necessarily intended to lead to binding agreements. And the third element is an informal diplomacy that happens, which means there's an interaction between public health actors, host country officials. There are public, private sector companies, NGOs that are all interacting with each other. So the way normally is that the formal negotiations which are happening between and among nations are happening at the core global health diplomacy level. And where the need for public health diplomacy came is at the intersectionality between informal diplomacy and multi-stakeholder diplomacy, which means that you don't have to have a credentials essentially to be a foreign diplomat to really build negotiations and consensus. And how can individuals beyond the formal training can actually facilitate or even influence the decision making after being engaging with other stakeholders that are beyond the formal credential diplomats. And that's where the field of public health diplomacy played an important role. So, if you have to define global health diplomacy, it's improving health and improving relationships among nations. And if you look at this pyramid, it's a very interesting way of looking at it. There are very few number of practitioners and with greater specificity who are trained as core global health diplomats. But if you look at the bottom of the pyramid, the actors which are host country officials, non-government organizations, universities, private enterprises, and public, they can play an extremely important role as informal global health diplomats, which means there's an interaction that is happening between the public health actors and their counterparts in the field. Agreements with private funding, academic, and other agencies can play a very, very important role. So, what this tells is that in the era of 21st century, we must reimagine public health from skills that are essential that we are training our professionals and practitioners to learn how to be even health diplomats. So, why public health diplomacy is a need? Now, if you recap, what I've mentioned is that the core global health diplomacy is happening at the top of the pyramid with more credential. But public health diplomacy, there was no such term earlier since last year when public health diplomacy was felt as a need and when the specific need was that how do we respond to the numerous global health threats. Countries and the representatives that do not interact solely through traditional diplomatic channels. Commitment to local, regional, and global cooperation and governance is key. And we must know how to communicate technical and complex information in a way that is understandable. It's very crucial for making influence given the need to work across different sectors with various actors that can influence public health outcomes. So many of you may, if you are coming from a public health background or a non-public health background, you may realize that there are a lot of sectors and actors that play a very important role as we make decisions about the various public health innovations and interventions, both at the local level or the regional or the national level. So I think that's where public health diplomacy started to play a very, very important role. Last year, we had our first public health diplomacy summit. I'm sure if you get a chance, you must go through this paper talking about the methods and the outcomes of first University of Memphis School of Public Health Diplomacy Summit that was done in 2024, and the findings of that were being published in the paper in Frontiers to talk about how do we define public health diplomacy and what role specifically the public health diplomacy can play in the schools and programs of public health. Largely, global health diplomacy or health diplomacy has been coming out of for schools of international affairs, foreign relations, but not necessarily coming out from schools of public health. So the need for public health diplomacy is traditional diplomats do require active engagement of health experts. We must need to design and negotiate frameworks and agreements that can address local health challenges in a collective manner. I don't use the word local, I don't use the word global, I largely use the word local. Why? Because there are many challenges that are driven both at the local level that do influence the global scale. So, value of integrating health into all government policies is recognized. We must feel the need for increased involvement both among diplomatic and public health forums to improve understanding of the interlinkages between foreign policy and local health. I also want to emphasize that as public health professionals, sometimes we are not even trained on how to build consensus. We are never told on how to build negotiations. We are not taught about how to do conflict resolution. So I think this reflects and became very important, especially during COVID-19, when it was found that it was so difficult for public health professionals to really respond to the crisis in a way that communication became a very, very important element. So if we are not trained effectively and efficiently on how to communicate information that is understandable, that requires certain skills. And I think at that point, it was demonstrated that public health professionals must be trained in diplomatic skills also. So, what are the challenges that we face in public health today? Is there's no standardized framework on health diplomacy in local and global settings. How do we align appropriate actors, tools, and expectations to build consensus negotiations across multilateral collaborations? So, in public health, obviously, we have to collaborate across different sectors. We have to collaborate with different actors. We don't have to just work with the hospitals. We also have to work with other ministries of education, finance, economics, trade, intellectual property transfer, digitization. There are so many other actors and tools and expectations that we need to look into that. So that means what are some of the specific health diplomacy skills, knowledge, and competencies that we need to train public health students today in? These are some of the papers that talk and highlight about since 2009, 11, and then 13, talking repeatedly about the role of health diplomacy, but not necessarily talking about the importance of health diplomacy among public health professionals. So, how will public health diplomacy be useful? Of course, we are talking about public health diplomacy, but how is it useful? So, one, it facilitates collaboration, enhances coordination, increases cooperation, and facilitates communication. These are the four C's, and specifically, these are aimed to support sustainable development, implement health programs in a complex environment. How do we reinforce collaboration between health and foreign policy officials, strengthen interaction among and between multiple actors and sectors? And extremely important is to facilitate data driven dialogue, evidence informed communications. This is aimed to achieve both fair and equitable health outcomes for better health security and population health. So, this is where public health diplomacy can play an extremely important role. So, feeling the need of public health diplomacy in 2024, last year, the University of Memphis School of Public Health and myself as a principal investigator established the first public health diplomacy lab at the University of Memphis. Now, this was the first of its kind in the country that really brought the context of local to the global influence rather than just focusing on the global lens or the local lens. What was this lab aimed to focus on? that we aim to bring together disciplines and stakeholder governments, NGOs, academics, and civic society to really improve collaboration, coordination for overall improvement of health and well-being through the understanding of broad stakeholder engagement, consensus building, and negotiations. I really want to emphasize and highlight the importance of consensus building and negotiations. Especially in public health, we keep on talking about stakeholder engagement a lot, but stakeholder engagement has to happen beyond individuals coming from health background. So the framework that we were incorporating was of SMART. In this case, there were two pillars. One, how do we diversify the actors and the stakeholders from the local to national to international? And who are the some examples of the other entities that we must engage to work with public health diplomacy, specifically legal and law? We must engage how legal regulatory frameworks of different governments can influence public health outcomes. Economics is a very important component. Trade and related policy is a very important component. Intellectual technology transfer, international affairs. Think of a way how many times schools and programs of public health do engage with all these different sectors. And that's a critical component, which means we must reimagine on how we need to train the public health workforce in the today's 21st century, specifically in the very fast, rapidly changing, complex, uncertain, and unpredictable environment. So, just to give you a snapshot of what we did, in July of 2024, the lab was established. In September, we did our inaugural Public Health Diplomacy Summit. At this point, I want to acknowledge our collaboration with the Association of Schools and Programs of Public Health and the Global Network of Academic Public Health. This 3 day summit led to the invitation and bringing together of 29 participants from 15 countries, including WHO and the World Federation of United Nations. This was a very broad stakeholder engagement, especially among all the regional schools and programs of public health around the world. The summit was done that led in November 2024 for us to establish the first public health diplomacy steering group. In December, there was an opportunity to present another a webinar on the role of global public health diplomacy. In April and May, we published the findings of our summit and then also participating in Regional World Health Summit. In June, I had an opportunity to present in the Europe at the Berlin Summit in ASFA's Deans and Directors Retreat. In July, International Public Health Diplomacy Advisory Group has been established. In August, we joined the Health Diplomacy Institutional Network, and in September, we had a quarterly publication of Public Health Diplo launched. That shows you how quickly the need and the importance and the relevance and significance of public health diplomacy was identified. These were the different countries that were participating across the region. I wanted to highlight this particular slide is to let you know that the definition of public health diplomacy never came just from an individual. It was a consensus that was built across regional participation of different schools and programs of public health. And that itself also demonstrated on how public health diplomacy can be used at the forefront to bring different stakeholders, different actors from different regions, and how their insight and input was taken into consideration. And this was an extremely well attended event where we had a very broad regional participation of the different stakeholders. And after 3 days summit, for the first time, the definition of public health diplomacy was built in consensus. Now, this was in itself a kind of a art and practice that was done. How it was defined, it's a multidisciplinary field. Our goal is to enable practitioners to effectively communicate, facilitate, negotiate, and build consensus using systems thinking, evidence based, community informed approaches that are based on equity focused and human centered values to improve health and well being for all. Now, I really want you to take a moment to read this definition because it talks about so many skills in the definition that go beyond just the traditional learning of public health. So, for example, effective communication is a very important element. How do you help facilitate discussions? Facilitation is a key element. How do you build negotiations and how do you build consensus? Do we train public health professionals and practitioners in areas of systems thinking? How do we bring data-driven, evidence-based approaches specifically in an area and time of misinformation, disinformation? How do we engage community-informed approaches and not leave it to just top-down approach or a bottom-up approach, but really use it a middle-out lens to bring this input? And how can we focus on human-centered values, which means for whom the policies are being made and for whom the services are being delivered, we must make sure that the users are a part and central theme to improving health and well-being when we are talking about public health diplomacy. So some of the findings, it was very interesting that a 9-point action agenda was defined, but I wanted to give you some very core skills that were being identified that we must be talking about. One, how do we bring and implement health diplomacy in a conflict zone? What are some of the cultural sensitive and inclusivity areas that we need to train public health professionals? How do we enhance visibility and advocacy? How do we engage communities and stakeholders? What role does data security and ownership plays in international collaborations? The second came about competencies that public health diplomats should have. This was very interesting, crisis management. Do we teach students public health crisis management and negotiation skills? Something to think about. Do we teach public health professionals about what is cross-cultural communication? How do we really ensure that when we are facilitating a dialogue, how do we take into account the cultural contextual relevance across different nations and different geographic settings, different regions? Are we teaching public health professionals to communicate in a language and plain communication that is understandable? Data analysis and knowledge transfer is a very important element. Leadership training is a key component. Systems thinking, I emphasize this, that systems thinking is an extremely important lens, which means we must train individuals, practitioners, professionals on how to connect the dots. Build trust and empathy. How do we teach public health professionals to build trust? And trust is a very important element to influence any decision. Cultural competency. Are we teaching public health professionals about interpersonal skills and conflict mediation? And I think this is where it becomes very important that public health diplomacy is an area that must be brought in the field of public health. What are some of the health diplomacy resources that we need to make available? What are some of the education and training modules? How do we enhance public health diplomacy education? And what are some of the infrastructure needs that are required for building collaboration and learning? I wanted to give you an outline of the 9-point action. So, for example, many times we do conferences, summit, people come, they attend, and then they leave. In this case, what we did, we emphasized that we must have an output and an outcome of this conference. And the findings was one, how do we really establish a global public health diplomacy working group? The second, this was very important that how do we create public health diplomacy capacity building group? For example, needs of Central Asia will be very different from Middle East. Needs from Middle East will be very different from Asia Pacific or Southeast Asia or from Africa. So how do we really bring that regional cooperation among the different associations and schools and programs of public health to talk about the importance of public health diplomacy? How do we identify global and regional specific learning outcomes? So that means, are we training the public health students to succeed in an interconnected and complex world through the regional and global learning outcomes? How do we advance public health diplomacy by engaging decision makers and stakeholders? We have established an interactive hub now that's acting as a resource for public health diplomacy research, innovation, skills, and experiential learning. How do we organize more and more events to create more awareness about the field of public health diplomacy in the field of public health? What are some of the region's experiences, best practices, and achievements? Which means we must gather evidence and the best practices that already exist, and how do we really kind of assimilate and kind of bring them together in one platform that allows to communicate to the different stakeholders. How do we expand regional and institutional partnerships and disseminate recommendation from participants to the respective institutions? This was a 9 point action plan that was supported by the participants at the summit to make sure that there is a continuum of public health diplomacy and its importance. We at the University of Memphis School of Public Health launched a quarterly annual magazine that is called Public Health Diplo. It covers what's the new things that are happening in the area of public health diplomacy and how public health diplomacy is now being expanded around the world. Uh, I, in this last part of my presentation, I wanted to talk very interestingly that we did a systematic review paper recently and just published. It's a paper in press right now, and it looked at all the health diplomacy curriculum and training that has been available uh, over the last several years. And some of the competencies and skills that were identified very critical related to health diplomacy was one, negotiation and diplomacy skills was a very important competency that was identified. Cross-cultural communication and leadership was also identified as a second key competency. The third was policy analysis and governance knowledge. The fourth was crisis management and emergency response. And the fifth was advocacy, coalition building, and system thinking. Now, if we really look at all the schools and programs of public health, to be very honest, it's very in a rare way that we teach even students about coalition building, system thinking, building trust, empathy, crisis management. How do we do cross-cultural communication? Now, communication is one thing, but cross-cultural communication is a very important thing, especially in the space of where we are engaging and interacting with different actors and sectors, not just locally, but also nationally as well as globally. Uh, Based on the work that has been going on since last year, there's a call for papers in public health diplomacy in a complex world. I wanted to make sure that you are aware of this. The Public Health Reviews and the International Journal of Public Health was very kind enough that they felt that this is a very important area to advance the field of public health diplomacy. We have the call for papers for publication, and individuals can submit whether it's a high quality reviews or policy briefs. These are some of the areas that are being covered in this edition of the edition of the journal. I'm happy to respond if in case you have any areas that you feel that you would like to submit an article. You can always reach out to me for feedback if your paper fits into this uh, domain. This is a very important way for us to really advance the field of public health diplomacy in a very complex world. There were certain calls for actions that we are hoping. We urge ministries, parliaments, cities, and regions, civic society members to engage in multilateral forums, invest in readiness and learning, and protect those who defend evidence. Align training, evidence, and financing of public health so that it can act together across borders to defend equity, rebuild trust, and safeguard well being for all. There is a need to coordinate and exchange agendas with existing public health diplomacy networks. We must look at what best practices public health diplomacy labs can actually come up with, which can exchange the results between organizations. We need to identify some of the areas on public health diplomacy that could address through these public health diplomacy labs. Each region has its own areas of focus. Deliver cross-sector briefings for foreign finance, security, and health decision makers to continuously track policy uptake. How can we launch a shared public health diplomacy curriculum that aligns core competencies across different networks and both different sectors, levels of government to take on geopolitical challenges to health? And how do we really establish a shared evidence to policy and communications hub that could help public health diplomacy labs and training institutions to develop a rapid response toolkit to debunk misinformation or fake news? Lastly, of course, public health schools must establish public health diplomats and ambassadors who could connect founding public health concepts with disciplines leading to the secondary school level to ensure health literacy citizenry. Can we convene cities and regions roundtable to seed cross-border transdisciplinary coalitions on priority issues for the citizenship and share tools on a common platform? And can we mobilize a pooled, flexible seed fund map with multilateral philanthropic and regional resources? And issue an annual progress report and metrics such as tools produced, training delivered, and partnerships activated. Uh, as these calls for actions were there are certain questions for us to think through. What role can public health diplomacy play to address global health challenges in an era of complexity, uncertainty, and predictability? I think what I really hope today that this topic really kind of ignites or triggers or kind of makes you think on how public health diplomacy can be an area that could be incorporated into the schools and programs of public health. What are the key actors and who are the key actors that we need to engage, and which sectors are critical to advance public health diplomacy for good health and well-being for all? So think of a way, if you go back, which and what kind of industries do you need, ministries you need to engage with? Do you think that you can actually really come up with the health and for all policies without engaging with the Ministry of Economics, Finance, Trade? You can't. You must know how to engage. And if you're not training up professionals and public health practitioners on how to engage with those professionals, to be very honest, it's going to be that health will not be at the table. And so people who would be making the decisions for public health may come from the background that are not familiar with what are the priorities and the areas that health should take into consideration. How do skills such as consensus building, negotiations, and conflict resolution advance public health diplomacy in a global setting? I really challenge some of the schools and programs of public health to really incorporate and instill these skills because consensus building is an extremely important element. How do you really help and train professionals to do negotiations? What are some of the conflict resolutions and techniques that we must advance public health diplomacy in a global setting? And most important role, what role can youth play to advance public health diplomacy in today's era? This is an extremely important information. Why? Because youth is getting bombarded with information overload, whether it's misinformation, disinformation, fake news. They just don't know or they cannot kind of even differentiate between what is right and wrong information. So how can youth today be trained as public health diplomats to really address 21st century challenges? So the last and but not the least, as Director General of WHO, Dr. Tedros mentioned, no one is safe until everyone is safe. So I think for me, the topic today that was chosen in the career and mentorship program series that the foundation is organizing every month is largely to is kind of ignite a new area of public health diplomacy in public health. And the fact that we are talking about this is a very important element because public health diplomacy, system syncing, negotiations, consensus building are key elements. So with that, I just hope that if there are any questions that are uh, that you feel that must be answered. But for me today, the topic was really to talk about this new area of field. And in our next session, I will definitely share with you some of the curriculum that we are actually creating to address this important element. So with that note, thank you, Shavni, and thank you, Ritika, for your coordination. And I'm open to anybody's questions right now.
Yes, sir. Thank you so much for this thought-provoking session. It was really insightful. Your session has reinforced the public health diplomacy that lies at the convergence of public health policy and foreign policy, serving not only to improve health outcomes but also to strengthen relationships among nations. A key takeaway that we all should be taking is the importance of reimagining public health through community-informed and human-centric approaches by grounding policies and lived experiences of and local realities. We should ensure that public diplomacy remains responsive, inclusive, and equitable. Uh, if anybody has any questions regarding these sessions,
Mohammed has
please
a
feel
question,
free.
Shravi. Yeah. Yeah, Mohammed, go ahead.
Yes, please.
Um, Good morning. It's very early morning here in Nigeria. We started the session around 4:30 a.m. Um, thank you, sir. This is the second time I have uh, uh I've seen engagement with you. Last time you visited us at Symbiosis International University and gave a talk about
Hmm.
something like public health. And then um sir, I have this question and concern. When I saw the mail regarding this public health diplomacy, I was so much moved by the concept of public health diplomacy. My question is, how can the training of, like, I finished my public health program in symbiosis, so now how can I get myself involved in this public health diplomacy aspect? And how can is there any training, like training program for like people like us that already finished or graduated from public health to engage or get along this public health diplomacy issue? That is
Thank
one.
you.
And two, that is
Yeah.
public health diplomacy, as you rightly mentioned, the actual stakeholders, some of them are not from the background of health or public health entirely. Then, so how do we get them along to get the work done? Thank you.
Mohammed, thank you so much. And thank you for that shows the level of commitment. And I can tell you one thing that thank you for taking the time to take this session. Let me tell you, there are two answers to this. One, public health diplomacy. I will tell you that there are several health diplomacy curriculum which are there, so that you can look into that. It's There is a health diplomacy institutional network that shows all the curriculum and training. But specifically for public health diplomacy, we will be starting a training program around summer of 2026. And the reason we are taking time about this is because in our review paper, what we found was that a lot of work in the area of health diplomacy or the training programs are very global north. They were not taking into account the regional and international context into that. So I'm hopeful that by building the approach by engaging the stakeholders from the beginning itself, we are really creating a very broad local public health diplomacy regional and international network, which allows different level of participation and different level of priorities, so that the curriculum and the training that will be given will have that context into the play. That's very important. That was one of the gaps we identified in the current training programs. So to answer your question, we are hoping that in the summer of 2026, as we are finalizing our second summit that is happening in March, we hope to come up with a regional and international training around this area. That's one. The second, you mentioned very interesting question is, how do you engage stakeholders that are beyond the health sector? So I think one of the areas is, I invite you that you should send me an email, and we would be establishing the kind of a public health diplomat young forum, and that forum is getting established. And one of the ways is that we are creating the public health forum that brings individuals from different kind of backgrounds. Since you are in Nigeria, we are collaborating with the Eastern Central Southern African EXA, which is in based out of, I think, Tanzania. That's going to be our regional partner within in Africa. That will help us identify some of the priorities that are very critical in the region in Africa. So, two things. One, you definitely can send an email expression of your interest. We will be launching this around January of the next year to bring the public health professionals with interest in public health diplomacy as a key component. I recently came back from workshop that was done at the European Health Forum Gastein. And in that workshop, we had an opportunity to engage with about 56 young European Health Forum Gasteiners. And these came from very broad backgrounds. I think the goal is to really take the field and its importance to the public health schools so that they can start incorporating these into the curriculum. So for those who are graduating, there will be a short-term training that will be available for public health diplomacy. Apart from that, if you send me an email, I can definitely send you the list of all the resources that are currently available out there. The third is you should get a chance. I am more than happy to share with you the paper. If you put your email in the chat, I'll be happy to send you our paper, which is its author's proof. It should be available anytime, like in a week or so, that talks about all the curriculum that exists in the space of health diplomacy. And the fourth is that we are hoping that to launch our Young Public Health Diplomats Forum that will allow different public health professionals around the world to come into play. Uh, and thank you so much for taking the time. I'm glad that that my talk at Symbiosis led you to even come back and attend this session. It really means a
Thank,
lot. Thank you.
thank you, sir. Thank you, sir. Thank you, sir. Nice having a session with you again, sir. Thank you.
Yeah, thanks, Mohammed. Any other
Thank
questions
thank
anybody
you.
else has? Okay.
Please feel free to use the chat box if you are not able to use your audio. Um,
So I think no worries. If there are any questions, my email Shravani has put it in the chat. I I will also, I don't know who you all are, Riya, Vaishnavi, Sheetal, Jayant, and at least, but or Suman. Let me tell you one thing that uh, thank you for taking the time to attend this thing. And remember that any innovative idea or concept does not mature into a full blown process overnight. You must remember that a very small seed of innovation can sometimes take a huge step forward in making a big difference in how we want to improve health and well being. So, my only suggestion to you all would be that you have to think out of the box, be creative, be innovative. And public health is all about passion. It's all about calling. It's about mission. Public health diplomacy requires you to know how to navigate the complex environments which are uncertain. Whether you are going to be in your workplace, whether you are going to engage stakeholders, whether you are in policy making, whether you are in the profession of teaching, whether you are in the profession of research, whether you are in the community of public health practice, you will require these skills today or tomorrow because conflict resolution, how do you respond to crisis, and how do you respond to emergent situations which you are not sometimes prepared for? So, coping, adaptability, resilience, and empathy. So, even if you have graduated from your programs, I highly, highly recommend develop continuing educational skills in these areas. These are extremely important because otherwise you will be feeling stagnated, and sometimes when crisis comes, we just don't know how to respond to that. So I highly recommend. And even as a dean myself, I'll be honest with you, I love learning. I think public health is a lifelong learning experience. And as much as you continue to read, write, you'll always evolve as a better learner. So my only suggestion is don't put a full stop into your learning, just put a comma. So that means you keep on adding new things to upskilling yourself on every single day basis. Learning never ends. You must continue to learn. I remember when I used to give talk about 12, 13 years ago, sometimes one or two people will join, and I would still deliver my lecture. And sometimes five people will join, sometimes 50 will join, and sometimes 10 will join. It does not matter. What matters today is, for example, Mohammed, that I gave a talk in Symbiosis. I don't even remember, maybe it was this year, somewhere, sometime. But somebody joining at 4:30 in the morning from Nigeria, I can tell you that your effort will not go waste. I promise you on that. Okay. So thank you all. Thank you for the time. And thank you for your patience listening. And thank you, Shervani, for organizing this event for today.